I'm an orthopedic surgeon, practice in the Inland Empire. I started practice after residency in Philadelphia in 1981. And I think my parents are both physicians, and I just grew up in that type of family. I had an advantage in some ways of growing up in California, and then I did my medical school in Guadalajara, so I learned Spanish, which was really helpful when I came back to California. After my residency in Philadelphia, where I met my wife, I came to the Inland Empire to practice, and I was practicing pretty intensely with surgery and general orthopedics until about 4 or 5 years ago, when I focused primarily on QMEs and workman's comp. But I've been doing the QME as part of my practice, QME evaluations, for the last 20 years. Sure, I went to, did my pre-med at Loma University, which is La Sierra campus in Riverside, California. Following that, I went to Guadalajara for 5 years for medical school. The last year I spent back at Loma Linda doing my work at Loma Linda. Then I did an internship in Philadelphia, followed by 2 years of general surgical residency, and then 4 years of orthopedic surgical residency. The QME certification process began, I believe, about 20 years ago. When it first started, I took the exam, passed, and became a QME. Prior to that, I had been doing some work as an expert witness in individual or independent medical reviews for injuries at either work or in the private sector. Well, I think every injured worker, particularly if they're represented by an attorney, are facing two fronts. One is the carrier, the insurance carrier, who would try to minimize the injury, and an attorney who may take an opposite approach. So you need to find out really what has in fact occurred at the injury, how that has affected the injured worker, and where he's going to be in life from that point onward. So it's sort of middle ground as a QME. You have to approach unrelated to what the attorney may want or what the insurance carrier would like, but really state it in a clear and precise way so that the injured worker not only understands, but both parties can come to an agreement on some form of additional treatment or a settlement of the person when he's maximally medically improved. Well, as you go through the practice of orthopedic surgery or practice of any specialty, you're going to find, unfortunately, individuals who overtreat or who undertreat, who do not listen to the patients. And as I am presented to the injured worker, I am not going to treat that patient in any way, and the day after I see them will be the day we part company, unless there's some reason to be reevaluated. But for that reason, I have nothing to gain by suggesting treatment or setting his impairment levels. So this is why there's an advantage as a QME to establishing what the patient's status is. There is no financial benefit for me to state a bias on either side.